We have a total of 13 active cases here in Foxboro. Of those cases, we have two. We have one person that was actually hospitalized, but that person has been released, so that's good news. So we have no people, no individuals actually in the hospital at this time. That's great news for the community. 206 total cases have been tested. In 206 cases have tested negatively here in the town. So we have that new statistic to report in, and we've had 217 sick calls that we've responded to, but of that, those statistics reflect the fact that we only have 13 total active cases in the town. So that's great news in that regard. So we will continue to keep this information up to date as much as possible. On the statewide level, we have now 829 cases in Norfolk County. That is as of yesterday at 4 o'clock, and 8.8% of the total cases in the state are now hospitalized. The 682 cases, 2,300 cases are not hospitalized. 4,700 cases are still under investigation. There have been 197 states of emergency declared throughout the Commonwealth, and so we have in total. Throughout the Commonwealth, we now have 7,738 cases and 122 deaths associated with those cases. The largest age group that is being affected by COVID-19 here in Massachusetts is in the age group of 50 to 59 years old. There were 1,500 cases that have proven to be in that age group. But it is pretty widely distributed throughout the age group from 20 to 70 years and older. Generally speaking, there are 1,200 cases, or 1,300 cases, etc., throughout those ranges. So they're pretty tightly listed. There is a little bit of separation between the 60 to 69 years of age group of 1,100 and 1,100 for the 70 plus year age group. The smallest group that is affected in the state is the 19 or younger age group, which is great news. Is 155 total cases that have been reported in that age group. So it's good to see that that area is still somewhat limited, but obviously we want to continue to do everything we can to flatten the curve here in Massachusetts, and I think folks are doing a really good job of doing that. So I'm really pleased to be able to report that out. So just some of the other information, the latest report that I have from the Board of Health. So for frequently updated information, you can click on the coronavirus info tab on the town's website, or go directly to the health department page at www.foxboro.ma.gov/department/health/COVID-19 health. The FDA has announced temporary flexibility in the menu labeling regarding to nutritional statements in response to the COVID-19 pandemic. This nutritional labeling requirement applies to chains with 20 or more stores. Several such chains operate here in Foxboro. The easing of the requirements is to address these requirements that are changing their menus in response to the pandemic. Questions continue to come in regard to essential businesses, and information related to the governor's order can be found at mass.gov/COVID-19 essential services. And I think that's the latest information that we have on that. And so it is interesting because it is subject to some interpretation, and we do have a couple of situations where we're looking at that very closely. It's not always 100% clear as to how that applies, so we're doing the best we can to work our way through that. Some of the other from the MRC, for the Massachusetts Medical Reserve Corps. Below is the most recent effects, and we talked about the fact that there were 682 hospitalizations according to the information yesterday, but we've updated that information since then. There is over 51,738 tests that have been applied here in Massachusetts. So we've actually breached that 50,000 test area. So we're glad to be able to report that. We were pushing on that pretty closely yesterday, and actually we surpassed that now. UMass Memorial Medical Center in Worcester is opening a temporary hospital campus located at the DCU Center to provide additional COVID-19 bed capacity for Central Massachusetts. An additional site will be opened at the Boston Convention and Exhibition Center. Staffing is an immediate need, so UMass is immediately recruiting employees, including nurses, PCAs, and other health professionals, as well as current students in a medical, nursing, pharmacy, physician assistant, or respiratory program. For more information and registration for those who wish to be considered is available at this link, www.joinumassmemorial.com, and they will be able to help you with that, any information. That again is www.joinumassmemorial.com. The state continues to actively seek personal protective equipment for frontline hospital and healthcare staff. If you know of any individual or company with supplies to donate or is able to manufacture needed protective equipment, please contact the state via the COVID-19 PPE procurement and donation program online portal, and that information is critical for us throughout as we address that situation throughout the Commonwealth. I will say on a very positive note that I read on ESPN this morning in the WBZ News that the Kraft organization actually was actually very instrumental in helping get some masks brought back to Massachusetts, which is they have a flight that's the Patriots signature plane was actually put into service to fly over to China to pick up 1.2 million masks that were funded in part by the Kraft organization, about a $2 million investment. To actually help bring those masks back to Massachusetts. So, and I understand that some of those are actually going to go to New York because they have a significant need there, but also a significant amount will be here in Massachusetts. So we're very grateful to the organization, the Kraft organization, for doing what they're doing, and just another indication of how community oriented they can be and what they're trying to do for the good of the Commonwealth and good for humanity in general. We are going to be working on another announcement associated with the Kraft Group later today, and we'll be able to report that out to you tomorrow. Another good news and appreciate and another positive piece of information that I'm able to report out involving the Kraft organization. So I'm really pleased to be able to do that. Skilled nursing facilities in Wilmington and Worcester have committed to designating their beds for COVID-19 related care for older adults with an implementation plan that will ultimately provide over 400 of the 1,000 bed target set for out-of-hospital care. Today, the governor announced that attorney Mark Perlstein will conduct an independent investigation of the Holyoke Soldiers Home and deaths from COVID-19 that have occurred in recent weeks. The investigation will focus on the circumstances that led to the spread of the virus inside the facility and on management and organizational oversight at the home relative to the COVID-19 response. Workforce employment, the governor's stay-at-home extension order through May 4th includes new and updated regulations for essential businesses. There's an updated list of essential services and frequently asked questions at the mass.gov site. Anybody has any questions about that, they can refer to that. The Massachusetts Cultural Council has announced an emergency grant program to provide up to $1,000 in relief for Massachusetts artists impacted by the COVID-19 conditions. The grant application will open April 8th, and more information can be found on the mass.gov site as well, / Mass Cultural Council. And then the Federal CARES Act stimulus bill includes $350 billion in support for small businesses nationwide. Businesses can borrow up to 8 weeks for payroll expenses, up to 25% based on February 2019 payrolls. And if employment is maintained, loans will be forgiven. These loans will be distributed through local banks, and small businesses owners should be able to work directly with their local bank. The applications are expected to be open by Friday of this week, meaning tomorrow. So just a point on that, it was brought to my attention that the application for small business loans was significantly reduced based on the circumstance that we have right now. When they originally passed the program in Congress, the application process is very substantial. It would be one that would take a significant amount of effort to actually get done for small businesses. And I'm pleased to report that Congress has improved that to the point where it's now about a 2-page application, which will make it a lot easier for folks to actually apply for those loans that are now available. The Senate voted to pass a new version of the House 4598 with changes yesterday, and which will enable municipalities and school districts to make needed changes to local services, as well as allowing bars and restaurants to sell alcoholic beverages for off-premise consumption. The bill is expected to be ready for the governor's signature by this weekend. $1.04 billion to Massachusetts for public transit to replace lost revenues and meet other transportation challenges associated with the impacts from the response to COVID-19. I'm also informed too that there is in the federal stimulus package, there is quite a bit of money available for cities and towns as well. I'm going to check the numbers again later today and get the breakdown of that. But my understanding is that there is a lot of aid available for cities and towns in light of the fact of all the impact that's been made to lost revenues for taxes and impacts to revenues such as motel hotel tax, as well as meals tax that has been lost throughout this crisis. Verizon has reported a significant increase in wireless data usage due to the transition, and many of our Commonwealth, many of our communities throughout the Commonwealth who have remote setups. To meet this need, the company has rolled out a series of initiatives designed to increase flexibility in customers' data plans and waiving overage charges for those impacted by COVID-19. For more information on Verizon's COVID-19 response, you can go to Verizon.com, and they will provide that additional information for you there. As you may know, also the 2020 census is now being circulated, and folks can actually fill that out. If you have a free moment today, if you're home, working from home, take the time to fill out the census. It's actually really important that we do that so that we can get our share of continuous share of federal aid throughout every year based on our population numbers. And then updated resources for residents experiencing job loss or loss of income. COVID-19 is causing a broad disruption in the economy, which is affecting incomes of many residents and families. There are a number of state resources and supports available to support workers who may find themselves unemployed or otherwise income constrained during this uncertain time. There's a new page that has been updated to reflect changes due to the passage of the Federal CARES Act and to provide additional guidance based on frequently asked questions that has been received. And for your convenience, you can find the guidance for guide of resource and information at https://Carolyn Dykema, which is DYKEMA @.com. So I'll spell it out for you: CarolynDykema.com/COVID-19-state-resources. That's the latest information that we have on that, which will provide you a full breakdown of what's happened in the CARES Act, and hopefully that can provide some really helpful information to you as individuals. All right, just on other areas that we want to address with you, it looks like there is I was just informed yesterday, rather, that there is a community needs assessment going on that was put together by Mark Craig and the Health and Human Services group, the Council on Aging group, and they're trying to get an assessment of seniors, but also through the general public to see if there are individual needs that will be available to you all. There's no guarantee we'll be able to provide all that, but we certainly want to understand what the need is so we can actually then focus our attention on those needs. So please, if you have an opportunity, go online, go on the town's website, and through our social media connections, we will connect you to that site where you can actually fill out the questionnaire that will be presented to you, and it will reflect an impact across the entire community. So that will be available. I'm told that was available at 10 o'clock this morning. So we want to make sure that if you have access to that, to make sure that you fill it out and get it back to us so we can actually have a better understanding of that. There's also been a question about the posting of the numbers of cases here locally. We're not doing that. There's been some advice given to us about posting those numbers on a local basis. I do provide you a breakdown of what's going on locally, and I do it on a daily basis. But we don't post them online because obviously they changes throughout the day. So we want to give you what I'm providing to you is actually a very up-to-date information that we have. It certainly will change, but we certainly don't want to give you information that will be incorrect by posting online, because that does change from time to time. And so we are going to continue to post the county numbers and the state numbers, but we're not going to post the local numbers. And then also for anybody who's interested in knowing this, but you may already know it already, but by watching this, but there is a rebroadcast of these Facebook Live sessions on Foxboro Cable. It's done at the top of the hour throughout the day, except for the 5 and 8 p.m. period hours, because during that period of time, the governor's rebroadcast of his press conference is done at that time. So they do provide this information on an hourly basis, but also the governor's rebroadcast is done later in the day at 5 and 8. So if you're not catching it this live, which is done at 10 o'clock every morning, you can certainly catch it on the rebroadcast throughout the day. And then I think that's all I have for right now. This is the latest information I have. We'll continue to provide this information to you on a daily basis, and we will get through this. I'm pretty confident we are, and I'm very confident we will. And I know that this will end. I did see a few trending analysis showing how cases are going to go throughout the state, and we should be hitting our peak probably within the next week or two. So I want to just make folks aware that there is an end in sight to this, and I think that it's important that folks understand that this was not going to take forever to get this done. We'll get through this, and we'll handle it, and we'll certainly provide you as much information as we can. So there is some questions about property taxes and how that's going to happen. Those are questions that have just become available to the town. We have not answered those questions yet because it still requires an action before the Board of Selectmen in order to address that. So we do intend to take up that issue at the April 14th meeting and see how the board wants to handle that. There is a provision in the new state Relief Act that allows for an easing back on penalties and on taxes, and also possibly moving of dates to collection to up to June 1st. We have not decided that yet, but certainly it's something that's under consideration, and we'll have more information on that later on in the month. So until then, until next time, which will be tomorrow morning at 10 o'clock, I want you all to stay healthy, stay inside if you can, and get out a little bit if you need just to exercise in the neighborhood, but certainly stay safe, and we'll see you next time. Take care now.